Hello and welcome back to GP Video Podcast by Nadia. So as we guys know that at this stage, Australia is experiencing very cold season along with rains and everything. Where I work, which is Yas community, there are lots of people getting Influenza A, Influenza B, RSV, COVID. So it's actually very rampant at this stage. Even people who are vaccinated, they are also getting the infections. The good thing is that people who are vaccinated are not that bad. They are not that sick, but of course, ones who didn't get a chance to get vaccinated are a bit more sicker, especially people who have got comorbidities, they are a bit more sicker. So just wanted to let you know because today is my telehealth day, and yesterday I was also doing telehealth, and even when I'm in the clinic, I do see at least 5 to 10 patients a day who are suffering from some sort of respiratory illness. They call it common cold, head cold. So symptoms can range anywhere from upper respiratory tract symptoms to lower respiratory tract symptoms. So for example, you can have runny nose, you can have like sinusitis kind of symptoms, you can have headaches, you can have body aches, you can have sore throat, you can have loss of voice, you can have, and then it starts trickling down the chest, and you can have chesty symptoms, very bad cough, productive cough, difficulty breathing. So all these kind of symptoms ranging from upper respiratory tract to lower respiratory tract are common. So my advice is that nowadays pharmacies do sell a kit. This kit, ideally is that you go to the doctor, but some practices wouldn't want you there if you are infected. But if you go to the doctor wearing mask and everything, if he or she does a nasopharyngeal swab for PCR for all the viruses and bacteria, that's ideal. But if it's not possible, then pharmacies sell a kit for RSV, Influenza A, Influenza B, and COVID. You can get yourself tested there on the red test, and if it's positive for any of these, please contact your doctor. If it's COVID and you qualify for antivirals, then antivirals would be given. If it's Influenza A, then Tamiflu can be given to you for 5 days, and Tamiflu can easily be given. It doesn't have many criteria or anything. If it's Influenza B and RSV, unfortunately there are no antivirals for it, but Again, at least we will know which virus is it, and also the guidelines are like Panadol, Nurofen, stay hydrated, and if you experience any danger signs like difficulty breathing, or in kids especially, for example, if the kid is not drinking at all, and refusal to drink, and significant decrease in number of wet nappies, difficulty breathing, high fevers, new rampant rash, and any of kind of symptoms that you think that extreme, like lethargic or drowsy. Being irritable is okay, but lethargic or drowsy is again another danger sign for kids. So please rush him to the hospital. You also, if you're not able to keep anything down and you have difficulty breathing, please go to hospital. And because bacteria are opportunistic organisms, and when your system is weak, they are very happy to just infect you straight away. So you might need antivirals, you might need antibiotics, you might need puffers, you might need cough syrups, you might need lots and lots of dehydration is the key. Steroids, you might need oral steroids. So please see your doctor. But before seeing, if you can do that kit test, and maybe you're not positive day 1, you might be positive day 2, day 3, just buy these kits and get yourself checked. Otherwise, have a PCR with a doctor. Take care of yourself. Vitamin C, immune boosters are very, very important, and just try and keep hydrated. Just try and keep as much as safe you can. Thank you so much.